The opioid crisis is directly impacting the lives of many people in New Hampshire, and residents are hoping for more concrete solutions from the candidates vying for their vote. So for more on this, I want to bring in Lisa Vasquez. She is a behavioral health strategist at the City of Nashua Division of Public Health and Community Services. She has worked on the mayor's opioid task force since 2016. So, you know, what we wanted to do by talking to you about this is bringing up some of the issues that are not really making the headlines right now. Yes, a lot of people are talking about the border. Yes, a lot of people are talking about the economy, but there are a lot of local issues that have a huge impact, and the opioid crisis is not so local. It's a local issue that we're seeing over and over again in communities across the country. Help us understand the extent of the opioid crisis in New Hampshire.
Well, in New Hampshire, we've seen we had a really big increase since 2016, 2017. We were probably one of the top 3 for opioid overdoses and fatalities per capita. We saw a slight decrease during COVID in 2020, and we're seeing a pretty big increase after COVID in opioid overdoses and fatalities in New Hampshire, but we're also seeing that across the country. We're seeing an increase in overdoses. So we're not alone in this in New Hampshire, but it is something that is impacting our community. And every one of those numbers is, you know, a member of our community, could be a parent, you know, a brother, a sister. So it impacts our entire community when we lose one person.
So how is the task force tackling this issue, which is so monumental?
We've been working on a variety of strategies, one being increasing the training and the distribution of Narcan. Narcan is a medication that reverses an opioid overdose. We also do a lot of education on what is substance use disorder. We help create the Syringe Service Alliance of the Nashua area, which is a syringe exchange so that people can learn about harm reduction strategies to keep them safe and safer, and to decrease HIV and Hep C in our communities as well. We want people to know that whether they're using or not using, they are valued in our community, and that whenever they're ready to enter recovery, they already are linked to the people who can connect them. We've been training people in churches. We've been training people in businesses. We've been training people in schools. We want as many people as possible to have access to this life-saving medication and to be able to administer in case of coming in contact with a person with a suspected overdose.
Are candidates addressing the opioid crisis in a meaningful way? I have to admit, my memory's not that great, and I don't know every speech that they're giving, but they tend to sort of hit the same points over and over again, and I don't know if the opioid crisis has actually come up.
I think because of the numbers fluctuating and other places across the country also having this issue, it hasn't been brought up as much, but it is still impacting our community, and it's taking people away from our communities that can be, you know, working and being members of our community. So it's really important not just to bring forward new strategies for substance use disorders and strategies for preventing overdose, but it's also important to look at the entire continuum from prevention, early intervention, treatment, and recovery services, and also to sustain those programs, because many times we get grants that last a year or 2, but the problem doesn't go away in a year or 2. So we need sustainable funding to keep those strategies going.
And that's such an important point, because I think that, as Anne-Marie pointed out, oftentimes if these issues come up in terms of national attention, it's around an election. And this is something that's year-round. Opioid addiction is not about red or blue, or Republican, Democrat, independent. Anybody can be trapped and wrapped up in this really, really horrific situation. I mean, it's just not tied to anybody who's in the White House, other than what they can do to help people across the country deal with it. So what would you like to see from the next president as far as your state's opioid crisis? Has President Biden done enough? Did former President Trump do enough when he was in office?
So one of the things that we need, again, sustained funding is really important. Many of the times we get, funding for a short amount of time. We get really great programs going, and then they go away, and those people feel left behind, or unvalued or let down. So we really need sustained funding to be able to keep these programs on for a long time. If we look at substance use disorder, it is a chronic brain condition. Just like any other chronic disease, we don't send people who have diabetes to a 28-day program and then say, good luck, and try to manage it on your own. But we do that for substance use disorder. So we can't just think about treatment for 28 days. We really need to look at the entire continuum of services, sober living, IOP, medication-assisted treatments, syringe service. We need to look at the entire continuum, sustain all those programs for a long term, so we can see actual sustained decrease in substance use disorder, not just a 1-year decrease or a 2-year decrease in substance use disorder. And we need to talk about it more. We need to get away from the stigma associated with substance use disorders and mental illness, and just talk about it more and make it known that we all know someone who's either having a substance use disorder issue or having a mental health issue, and it's not something that we should be ashamed of talking about. And it's okay to ask for help if you're not feeling great, and help is available, but we need to ask for it, we need to talk about it, and we need to keep it up in everyone's mind and on the headlines, so that we can, again, keep these programs going, sustained, so that people don't feel left behind.
Lisa Vasquez, doing such incredibly important work. Thank you for sharing that insight with us. Thank you very much. Appreciate it.
Thank you for having me.